Now let me show you a case of a bone-supported surgical guide. A bone-supported surgical guide means that you are going to raise a mucoperiosteal flap, a full thickness flap, and you're going to place the guide on top of bone directly, and you're going to start drilling. So this is a case of an atrophic ridge. I just put 2 implants. It's better, it's an overdenture, better to put 4 implants, but for the sake of the timing and the tutorial, I just put 2 implants just to show you the idea. Let's go to implant planning. And as usual, I'm going to get the DICOM. I'm going to get the double scan protocol of the denture, and I will show you one trick which is very nice. Okay, let me get the DICOM of the patient here first. As you can see, I did this trick. I used the cheek retractor while radiographing the patient. Okay, if I get the threshold here, you can see the bone of the patient, and if you decrease the threshold, you can see the cheeks are retracted, and you can see the teeth of the denture. I will tell you the significance of this in the next step, but take a note that the patient was radiographed biting on cotton rolls and with the cheeks retractor. Let's get the bone filter again, and let's click next. Now I have my arch curve, but remember this arch curve is wrong because you can see the arch curve is for the upper arch. I need it for the lower, so make sure that the arch curve is for the arch that I choose or I need to work on. Let's adjust it. And just let's click next. And now we have our CBCT. So to draw the guide on the CBCT, it's not possible to draw the guide on the DICOM file. We need an STL file. And since we need an STL file, we need to do what's called a conversion to an STL file or a surface file. So let's maximize this in the DICOM control. You have ISO surface. You can control the threshold from here, like this or like that. Okay, I will just get the proper threshold where I can see the bone clear with no noise. Okay, and I will go here to surface generation, and I will click generate surface. Now I have another surface. If I hide the DICOM, you will see it. I will show you this later, but this is a surface for the DICOM file. So I have the bone and teeth in both DICOM and surface modes. Let's click next. We are going to do a CT to CT alignment because we want the prosthesis, the denture. We are planning all the time a prosthetic driven. So I need to see the denture here. Even if I'm going to draw or make the guide on bone, it's essential to see the implants from a prosthetic perspective. So let's click next. Now I have my denture. It's a double scan protocol, and if you can see this denture has no radiopaque markers. I did not put any radiopaque markers. So let's see how can we do the registration. Normally we have radiopaque markers in the denture during scanning in the patient's mouth and during scanning separately. But in this case we don't have. It's a trick that I use. It's evidence-based and published, and we can click next. Now for the registration, it's not possible to register with this threshold. So I'm going to reduce the threshold. Now you know why I did the cone beam CT with the cheeks retracted. Okay. Of course, the software will fail to do automatic registration with the markers because there are no markers in the first place. Let's start. Take some points. And from the other side too. And 1 point anterior. Make sure it's the same point and just click next. and it is registered. Okay, you can see very good, excellent registration. If you need to adjust it manually, you can go and make just fine manual adjustment. I don't need to do this. I'll just click undo, go back to evaluation. I think the registration is very nice. Look from different angles, from different perspectives, from panorama, from the sagittal or cross section I mean, and continue with acceptable alignment. And let's go to the implant planning.